Thank you, Chair, for the opportunity to appear before the committee today. Epilepsy Queensland's submission centred on the voices of our community, but there were many experiences it could not fully capture, like the regional Queenslander who lost their job after being told they could not be rostered on until they could predict when their next seizure would occur, or the father whose family saw the toll epilepsy took on his well-being and the children he loved. He later took his own life. Or the teenage boy whose classmates repeatedly tried to provoke a seizure by hitting him on the head. Or the many families who've lost loved ones to epilepsy, telling us they wonder if greater awareness of the risks might have made a difference. These stories all point to the same truth. Epilepsy is more than just seizures, and it requires care beyond the clinic door. Epilepsy shapes whether people can work, learn, connect, and live safely. It's a whole-of-life condition that requires a whole-of-government response through a funded National Epilepsy Action Plan coordinated through Epilepsy Australia as the peak body. Clinical care will always be the foundation of epilepsy care. An optimal care pathway must establish nationally consistent pathways from first seizure through diagnosis, treatment, escalation and post-clinical support. Around 50,000 Queenslanders live with epilepsy, yet in 2024, Queensland only had 128 neurologists and only a small portion of whom specialise in epilepsy. A national plan must respond to the workforce shortages that contribute to misdiagnosis, delayed diagnosis, regional inequity and ultimately ongoing seizures. But if we stop at the clinic, we leave families to navigate the rest alone. And Leonie will now outline what this means in practice.
Our consultation has identified 4 broad priority areas. Firstly, support beyond a clinical diagnosis. Facilitated referrals to epilepsy organisations such as ours must be built into the care pathway so families are not left to navigate epilepsy alone. We provide the education, navigation and ongoing connection that clinical pathways alone cannot. Yet this post-clinical support remains undervalued and underfunded. After accessing our support, more than half report they are less likely to call an ambulance after a seizure as they felt more confident in managing the epilepsy safely. And our national peer support program, delivered by people with lived experience, provides connection and builds confidence, yet its current funding ends in December. Secondly, epilepsy care must address uncertainty, fear, safety risks and isolation. People with epilepsy are up to 5 times more likely to take their own life, and approximately 50% have anxiety and/or depression. Yet mental health care is often out of reach, especially for those with employment barriers. Funded counselling is needed to help families navigate a life-changing diagnosis. Thirdly, epilepsy must be recognised for increased practical support. When people lose their licence, they can lose their job, their independence, access to healthcare, education and community participation. Transport subsidy eligibility needs to be broadened. Ongoing seizures also affect functioning across all 6 NDIS domains, and drug-resistant epilepsy must be appropriately recognised so people are not left without support. Lastly, epilepsy understanding must be embedded across the systems that people rely on, including schools and childcare, where epilepsy education should be standard, as well as in primary healthcare, frontline services, employment, transport and community settings. We see the difference this makes when employers and community-facing organisations undertake our training, building inclusion and also preparedness for the 1 in 10 people who will experience a seizure. We see it when we provide training as standard onboarding for childcare centres and disability organisations who know that understanding goes beyond seizure first aid. In summary, seizures can be frightening, unpredictable and sometimes life-threatening, creating fear, uncertainty and constant vigilance. But the real impact continues after the seizure ends, and that is why a national plan must go beyond clinical care to address its whole-of-life impacts.